There were several presentations on CC-486 related to the QUAZAR AML maintenance study. I think probably the most important one for me was the study that looked at the role of measurable residual disease. And we had previously conducted a much smaller single institution study where we looked at decitabine maintenance, and in that study, we had looked at measurable residual disease assessed by flow cytometry at the time of enrollment. And we actually showed in that study that flow positivity was the most important predictor of outcome. It's actually in this much larger study, the QUAZAR study that enrolled over 470 patients, it was actually satisfying to see that overall multi-parameter flow cytometry was a important predictor of relapse-free and overall survival. And the role of CC-486 was important because it was seen in this study that CC-486 improved relapse-free and overall survival both in the MRD-positive setting and MRD-negative setting, or MRD-positive patients or NMRD-negative patients. And also importantly, it showed that it was able to convert MRD-positive to MRD-negative. So this is an important study for me. Again, further emphasizing the importance of MRD assessment in any setting in AML and even in the maintenance setting, and also the importance of identifying agents that can convert MRD positive disease to MRD negative situation. Other studies were also presented. One particular one was as a part of the design of QUAZAR AML-001 study. Patients had bone marrow exams every 3 months, and they were evaluated. And any patients who had either in the peripheral blood or bone marrow had 5 to 15% blasts, so that's a sort of an early relapse situation, were able to extend the dosing of CC-486 from the 2 weeks, that was the original design of the study, to 3 weeks. And this strategy seemed to be useful, at least in many patients, producing higher responses and also improving survival of the patients who converted.